Newman Medical is proud to introduce our simple ABI systems for the reimbursable diagnosis of peripheral artery disease, or PAD. These systems produce everything needed for the most common and appropriate basic test for PAD, a complete ABI test with PVR waveforms. Medicare reimbursements for this test range from $102 to $153, with a national average of $114. Additional lower extremity arterial tests such as segmentals and pre- and post-exercise ABIs are also possible with the simple ABI systems. These systems pay for themselves in less than 1 year, doing only one test per week. If 2 tests per day are done, they are paid for in less than a month. Besides being good business, the diagnosis of PAD is also good medicine. PAD is still an underdiagnosed, undertreated disease with serious consequences. If not diagnosed and treated, 1 in 4 of your patients with PAD will suffer a heart attack, stroke, amputation, or death within the next 5 years. Patients at high risk include those over age 70 or those over age 50 with diabetes or a history of smoking. Leg pain or coronary, carotid, or renal artery disease are also risk factors. At Newman Medical, we have 2 simple ABI systems. The System 300 is a total package. In addition to the system's Doppler, PVRs, inflator, and special vascular cuffs, the System 300 includes a Hewlett-Packard mini laptop, a sturdy rolling stand, and a wireless printer that can be placed anywhere in the exam room. If you already have a laptop and printer available for testing, our simple ABI System 100 without the computer, stand, and printer is a very attractive solution. It still includes all of the essentials, including the Doppler, PVRs, cuffs, and most importantly, the simple ABI software. Our simple ABI software is uniquely easy to use. Completing the test is a matter of simply filling in the blanks on the report that is displayed on the computer screen. The test itself is very simple and straightforward. First, fill in the patient information on the form. Start the test itself by wrapping all 4 cuffs, then take the brachial pressure using the Doppler probe, usually on the radial artery. Inflate the cuff until the Doppler signal disappears. Then deflate and note the pressure when the Doppler signal returns. Enter that number into the brachial box on the form. Now go to the ankle and use the Doppler at the posterior tibial artery just below and behind the ankle bone. Inflate, deflate, and enter the pressure in the PT box. The new CPT codes for 2011 required that the ankle pressure also be measured using the dorsalis pedis artery on top of the foot. Again, after inflating and deflating, record the pressure in the DP box. PVR waveforms are necessary for reimbursement, helpful for diagnosis, and with the simple ABI systems are very easy to obtain. PVR waveforms are easier to do than Doppler waveforms. Inflate the ankle cuff to about 65 millimeters and leave it there. This is very easy to see on the computer by noting that the green bar on the computer is within the box. Now click or press the Get Waveform box, and in 5 seconds the PVR waveform appears. Repeat this sequence for the left side of the body. That quickly, the whole test is done. The computer automatically calculates the correct ABIs. Click Print and the report is wirelessly sent to the printer and printed with everything you need, including the CPT code, some common ICD-9 codes, and the most widely accepted interpretation of the ABI values. If desired, the report can also be stored or emailed. Thanks for your interest in the Newman Medical Simple ABI systems. We believe that they are the quickest and easiest way to get a vascular lab quality report for reimbursement and to improve patient care in your practice by the early diagnosis of PAD.